All right, today we're digging into a really fascinating story. How exactly do you build a top-tier medical institution, basically from the ground up? We're going to use Rehman Medical College as our case study to see how they're completely changing the game for medical education in their region. Let's jump right in.
So, let's start with this big question. How do you actually build a legacy in medicine? Well, it's definitely not just about fancy buildings and equipment. It's really about having a powerful vision, growing in a smart, strategic way, and ultimately leaving a real impact on the world. This is the story of how one college is doing just that.
You know, every great institution really begins with a single, powerful idea. So to get what Rehman Medical College is all about, we have to start at the beginning. We have to understand the why that got this whole thing started.
And that why really came from one person, Professor Dr. Muhammad Rehman. Now, this wasn't just any doctor. He was a trailblazer, a truly renowned cardiothoracic surgeon in Pakistan, and he saw a big problem, a problem he knew he had to solve.
And this quote right here, this was his mission. Dr. Rehman saw this huge gap in the system. He had a vision for an institution that would do way more than just teach medicine from a textbook. He wanted to create a new benchmark for medical training, one that perfectly blended the latest science with real, compassionate patient care. That vision, it became the foundation for absolutely everything that followed.
Okay, so the vision was there, it was crystal clear. But the next big question is, how? I mean, how do you take a powerful idea like that and turn it into a real, living, breathing institution? Well, the answer is in a very carefully planned journey. And listen, this did not happen overnight. You can see from this timeline, it was a very deliberate, step-by-step process. It all kicked off back in 2002 with a state-of-the-art hospital, the Rehman Medical Institute. That hospital became the clinical backbone for everything. Then, 8 years later, in 2010, the college itself, Rehman Medical College, officially opened its doors. By 2015, they were celebrating their very first graduating class, and they had full recognition from the Pakistan Medical and Dental Council, which is a huge deal. And they didn't stop there. By 2020, they were already pushing forward, expanding into digital and simulation-based learning. Just constant evolution.
So now we get to the really juicy part, the what. What is it that makes RMC's whole approach to education so different? This is all about their unique philosophy, what you could call their academic DNA.
Right at the heart of how they teach is something called an integrated modular curriculum. Now, what makes this so revolutionary is that instead of just, memorizing anatomy books in a vacuum, students learn all that science in the context of real patient problems. And they do this from day one. It's a game changer, really. This method helps them think like doctors sooner and actually helps them remember what they've learned for the long haul. And this really shows you the contrast. On one side, you've got the traditional way of doing things, lots of rote memorization, learning subjects in silos. But the RMC approach is all about solving clinical problems. The whole point is to create doctors who can think critically and adapt, not just spit back facts from a textbook.
And believe it or not, this entire philosophy, this idea of blending science with practice, is actually visualized perfectly in the college's emblem. Seriously, it's not just a logo, it's a mission statement.
So let's break this down. First, you have the caduceus, that ancient, timeless symbol of medicine. But then, woven right into it is the DNA double helix, the symbol of modern, cutting-edge science and research. The way they are entwined together says it all. Their mission is to integrate that hard science with compassionate, hands-on care for patients. It's brilliant. And holding this whole philosophy up are these three core pillars, which also happen to be the college's official motto: knowledge, service, and excellence. This is the value system that drives everything they do, from what happens in the classroom to how patients are treated in the clinic.
Okay, let's zoom out for a second and look at the where. Because RMC doesn't just exist on its own. It's actually the academic heart of a much bigger, all-encompassing healthcare ecosystem. And here's a huge piece of that puzzle. RMC is tied directly to the Rehman Medical Institute, a major hospital with over 500 beds. And this isn't some distant partner facility. This is the student's real-world classroom, where theory slams into practice every single day. And it gets even bigger. The institute isn't just for future doctors. It's a whole hub for healthcare education, with colleges for dentistry, nursing, rehabilitation sciences, you name it. This creates this incredible environment where future doctors, nurses, dentists, and therapists are all learning side by side.
And of course, this entire ecosystem runs on people. It's a massive community, all focused on health and education.
We're talking over 150 full-time faculty, more than 600 staff members, and a super vibrant student body of over 1,200 people.
So we've covered the why, the how, the what, and the where. But all of that leads us to the most important question of all. So what? Right? How do we actually measure the impact of this place? This is where we look at the results.
Here's a number that speaks volumes. Over 450. That is the number of research papers published by RMC's faculty and students in internationally respected journals. This tells you they aren't just consumers of knowledge, they are actively creating it and contributing to the global scientific community.
And the recognition they've earned is both at home and abroad. RMC has a top-tier A ranking from its national board. It's also listed in the World Directory of Medical Schools. And here's the kicker. Its graduates are eligible for ECFMG certification. That's the key that unlocks the door to practicing medicine in the United States. It's a huge stamp of approval, and as you can see, their alumni are now working in communities all over the globe.
And really, this is what it all comes down to. The buildings are state-of-the-art, the curriculum is brilliant, but the true, lasting legacy of Rehman Medical College is its people. It's the doctors, the researchers, and the healthcare leaders they send out into the world who are now shaping the future of medicine not just in their home country, but everywhere.
So from a single founder's vision to a truly global impact in just a couple of decades, it's a pretty remarkable story. And it leaves us with one final, really exciting question to think about. With a foundation this strong, what will the next chapter of this legacy be?